Very good morning to all of you. Welcome to the Medical Legal Conclave of Akriti. Akriti is a group of 18 friends who wants to do something different, not only sitting in a kitty and eating and chatting. In that way, the Akriti has come in front of you with the breast saga 6 months back, and today here we are with the Medical Legal Conclave, which is today is the burning topic for all of us. We are wearing a sari which is not white. Why? Because the white color of a doctor is become red with the blood of red and become little bit dirty with the why? Who is at fault? Whether we or the society? I think somewhere us, because we don't go to the society and tell our part. Because of that, today's the Medical Legal Conclave is bridging the gap with the society, with the lawmaker, with the policy makers. And my request to each of you, very much in time, very crisp message to everyone. And the extra talking is a main culprit. What you talk unnecessary in front of the patient, what your staff talk, and this sometime take you to the court. So learn here first thing to give the crisp message, precise message, follow the protocols, follow the SOP, and document everything.
So I bring greetings from University College of Medical Sciences and GTB Hospital, Delhi, and also from my committee, Foxy MTP committee. So I'll be speaking about the safe abortions and the forms and the implementations. So now what is safe abortion? Now we all know that the abortions has been legalized in India since 1971, and these abortions or the medical termination of pregnancies, it is governed by the act which is called MTP Act. So MTP Act we all know started in 1971 and then it had gone under amendments, and now we have the recent 2021 amendment. So now MTP Act, it clearly says who, when, where and documentation. Now it has clearly defined the person who should do the MTP, then the place where MTP should be done, indications, and then the paperwork. Now this was the journey of the MTP Act amendments 2021. Now finally the new amendment it was notified on 12th October 2021. So now let us in next 3 slides I will quickly revise what is MTP Act and then I will go into the paperwork. So now this slide is very important. Why I am putting all this 3 slides whenever I do my presentation, because at the night also 10 o'clock or 11 o'clock I get a call from various people and they ask, Madam, is this the indication for MTP at 20 weeks? Or is this the indication at 24 weeks? So I still feel that people are little confused. So this slide is very, very important. Now who should do the MTP and who should give the opinion? Now we are very much clear that up to 20 weeks, 1 registered medical practitioner opinion is needed, and between 20 to 24 weeks for termination of pregnancy, 2 RMP's opinion is needed. Now who all can do the MTP and who all can give the opinion? I have put this, simplified this. Now here you can see up to 24 weeks, any registered medical practitioner who has a PG degree or a diploma in obs and gynae, we all can do up to 24 weeks. But then the MBBS doctors or the registered medical practitioner who have the specific training, so they also are authorized to do the MTP till 24 weeks. And who are they? Like if they have the experience of obs and gynae in family planning for 6 months, that is they have done the house surgency for 6 months, or they have 1 year of experience in obs and gynae. So these MBBS doctors, they also can do the MTP till 24 weeks, provided all the criteria are met. So then, now the new things which has been added after this amendment is MTP up to 9 weeks by medical method of abortion. So MBBS doctor who has 3 months of training in obs and gynae, or they have given the MTP by medical method under supervision to 10 women, so they are also authorized now that they can do the MTP by medical method only. So these are the things, and after 24 weeks, it is the medical board who will take the decision regarding the MTP. So this is the slide who can do, and then when MTP should be done. Now this also is another very important slide. Now we all know that the gestational upper limit has been increased to 24 weeks, but only in the certain category of the women. So as you all can see, up to 20 weeks who all are entitled for MTP. These are the 5 indications which were already there from the beginning, and again I will just repeat, that is to save the life of mother, to prevent physical or a mental injury to the mother. Then if there is a risk that the baby will be born with the congenital anomalies, humanitarian ground rape, and then contraception. Now this contraception clause has been amended. So now the unmarried girls, they are also included under this purview. Now the gestation limit is increased for 7 people. Who are they? Those are the survivors of the assault, rape or incest. Then the minors. Now if the woman has become a widow or she is divorced, she is also entitled for MTP till 24 weeks. And then the congenital anomalies. Now congenital anomalies, they have clearly specified that anomalies which are incompatible with life, or those anomalies which will put the baby to a serious risk that the baby is born with a physical or a mental handicap. So only those anomalies are to be covered. And then of course is the pregnancy in the humanitarian settings. After 24 weeks, it is only and only for the fetal congenital malformations. Now suppose after 24 weeks, say for 26 weeks, if you get a patient who is unmarried or a girl who has come with a pregnancy of a sexual assault or whatever, so still the board does not have the right to give the approval or the denial in this case. So again, she has to file a writ petition and get the order. So board will take the decision only for the congenital anomalies after 24 weeks. So this we are very clear. Now where MTP should be done? Again, government hospital. So government hospital, they don't have to take any kind of approval by default, they are already approved. But if it is a private setup, you have to take the approval from the government, and that is from the district level committee. Now this is the most important thing now, documentation. Now why documentation is very important for MTP? Because now after the amendment, now there can be the 1 year of imprisonment in addition to 1,000 rupees of fine, which was already existing long back. So now these are the 4 types of the forms which are very, very important and we have to fill. Either you are doing by medical method, first trimester or second trimester or even now third trimester, or by surgical method, suction evacuation, or by tablets, anything. You have to fill these kinds of forms. These are the 4 forms. But if you are dealing the patient like a missed abortion, incomplete abortion, or a ectopic pregnancy, you don't have to fill this form. Okay? So these are the 4 forms. So I will go into the details of these forms. So this is the consent form. Now the format has been clearly defined by the Ministry of Health and Family Welfare. This is these are all the forms which I have got from them. So this is the consent form. It is called Form C. Okay, and this is a self-explanatory. You can see we just have to write the details of the patient. Now if the woman is more than 18 years, so she can give the consent for MTP. Consent of husband or relative is not at all required as per the law. So, but if she is less than 18 years or if she is a minor or she is having a mental abnormality, so the guardian signature is required, and the guardian need not be the blood relative or the parents. They can be any person who is taking care of that woman. So that is the definition of guardian. So guardian will have to sign here. So now this form is only for the consent for the MTP. And the risk of the MTP or regarding the complications, you should have the other consent also. So whenever I am talking about the MTP consent, it doesn't mean you just fill this form and close the chapter. This is of course a medico-legal form, and the consent this has to be signed. But in addition to that, all the complications of the medical method or the surgical method should be explained to the patient and should be documented. Now this is the form 1. So this form we have to fill when we are doing the MTP till 20 weeks. So this is the format. So now we know up to 20 weeks, only one RMP opinion is needed. So we write the details of the one registered medical practitioner, and then we write the serial number. Now what is serial number? I will be explaining to you in the next few slides. So in the form 1, we have the 5 categories which are already mentioned. So you have to choose whichever is most appropriate, and then RMP has to sign here. Now this is the form E. It has been introduced after the amendment, and this we have to fill when we are doing the MTP between 20 to 24 weeks. So here the 2 RMP details has to be written here, and then the 7 indications are already written. You have to choose whichever is most appropriate, put a serial number also, and then 2 RMP signature is mandatory. So this is the form E. And then this is the format of the form D. Now medical board, they are supposed to give their opinion yes or no in this particular format. And the board has the authority only for the congenital anomalies after 24 weeks. Now this is very important form, it is form 2. Now in this format we have to send all the entries, what all MTPs we have done in the last month. It has to go to the district authorities every month, preferably within first week. And here clearly you have to mention which month, then your hospital. I hope it is not visible. Okay, I'll read it out. So what all MTPs you have done in the last month, up to 9 weeks, up to 12 weeks, then 20 to 24 weeks. So you have to write the total number of the MTPs what you have done. And other thing is that after the amendment, of course, 20 to 24 weeks and beyond also is added in this form too. So it is amended after the amendment. And then religion also we have to write. If you can switch off this light, I think it will be more visible, this form. No? Okay. So, okay. So, we have to write the total number of the women in different religion also who had undergone the MTP. And then we have to write what all contraception they had chosen, total number of the women. So, after amendment, 2 points are added, that is the OC pills and others, or injectables. So that also we have to write. And then the indications. Now the different period of gestation, what all indications, the total number women who had undergone MTP. So we have to write the total number. And then the family planning unit head has to sign, and the department head has to sign, or if it is a private setup, then the owner of the hospital also have to sign, and it has to go to the district authorities every month. Now this is very, very important form, that is form 3. So after amendments, the 2 more columns have been added. So initially there were only 14 columns, and now we have 16 columns. Now this is called the admission register. It is a very confidential document. You have to keep under custody. And this register will have all the details of the patients. You are ideally not supposed to show these details or this register to any husband, relative, or even the police till they have the court permission. So it is that confidential. You have to preserve these documents for at least 5 years. So now here you can see, and then this register you have to start every year. From the January you have to start, put the month and the year. So these columns are fixed, that is serial number, date of admission, name of patient, and so on, then the indication, and then what all method you have used. Now the 2 columns which have been added is that the method by which you have done the MTP, and then the contraception what they have chosen. Now I was talking about the serial number. So now here you can see the first column, it is written serial number. So whenever any patient comes for MTP, you have to write all the details and assign a particular serial number. So hereafter all the documents ideally should have the serial number and not the patient's name, including the inpatient papers and even the discharge summary ideally, to maintain the confidentiality. Now suppose if you have a patient, now it is called the admission register. Now if you have done the MTP by medical method, so what will be the date of admission or the date of discharge? So that also is confusing. So it is very clear, the date of admission will be the day when you are giving the mifepristone, and the date of discharge you will put on the around day 15 when she has come for the follow-up. Now suppose the patient doesn't come around day 15, so in that case the date of discharge will be the date when you have given the misoprostol tablet and you close the entries. So this is about this register. So again I repeat, so what you all have to do, the consent form is very important, RMP opinion form, these are very confidential document. Keep it, seal it and preserve it, and then keep a copy of monthly format also, and the admission register of course is very confidential document. So MTP Act is all about these 4 documents. So as long as you fill these 4 papers, you are medico-legally safe. Now another point is that who all can do the MTP? I told you that the government hospital, they have the authority. Okay, just few slides, I'll just skip. So, and the private setup, you all have to take the permission from the government. Okay, so I'll not go into the details. So, but now who all can be given the permission or the approval is now, after amendment, we have 3 categories. So, up to 12 weeks you can take the approval, or up to 24 weeks. So, private setup, we are authorized only till 24 weeks. So after 24 weeks, it is the medical college. So you have to have the certain infrastructure, you have to fill up those before you apply for the approval, and up to 24 weeks, so you should have the anesthesia facility and performing the surgeries. But after 24 weeks, it is in the medical college only, and they should have the facilities for the procedure under ultrasound guidance. So this is the basic criteria before we apply for the approval. Now Form A is very important. Here in this format you have to apply for the approval. I just want to make a very clarification here that the people who got your approval for 20 weeks before the amendment, it means 24 weeks. So this automatically means 24 weeks. But then again you don't have to reapply for the re-registration. But then you have to write an application to the CMO of your area and get your Form B updated, because here it is clearly mentioned that you are entitled up to 20 weeks. So if you are already approved for 20 weeks, so you have to get it updated for 24 weeks. Why? Because you have to display this form in the place wherever you are doing the family planning services, and then patients should not get misled also. So you have to get this form updated, that is the thing, and you don't have to reapply for re-registration. Now once the approval for the particular place is given, it is permanent. You don't have to reapply for the renewal at all. But then you have to remember that the CMOs, they may come for inspection from time to time. So you have to maintain the standards whatever has been laid down by the MTP Act. And suppose during the inspection they find some flaws, and they find if the MTP was not done under safe and hygienic condition, then they can recommend to the district level committee, and the committee may cancel the registration. So you have to keep up your standards for MTP. So this is the procedure how you go. I have already explained. Now one more slide which is very important regarding the offenses and punishments. I have told you who can do the MTP, the place where MTP should be done, and the indications. Now if a person who is not authorized is doing MTP, the place which is not authorized letting it do MTP, and failure of documentation, so we can have the imprisonment somewhere between 2 to 7 years. And the documentation, I have already told, imprisonment can be there up to 1 year or 1,000 rupees of fine. Again, if you are doing the MTP without the listed indications which I have already told, so in that case also we are liable for imprisonment up to 3 years or 7 years or even 10 years. Doctor as well as the woman who has undergone the MTP. So we have to be very careful. MTP without consent is a very serious offense. Now, if there's a death because of MTP, but you have taken the consent, there can be imprisonment of 10 years. But I'm not telling this to scare everybody. I'm just trying to give a message that we have to be very clear about the drug protocols, about the investigations, paperwork, and everything. So as long we have maintained everything, all the documents and all the drug protocols, so we are safe. Okay, it is if there is any flaws in that, then only we will be caught. But we have to be aware what all are the offenses and the punishments which are associated with MTP Act. So now the FOXI, we have released the GCPR also, good clinical practice point on abortion, that is up to 24 weeks and beyond. Last month. So all the FOXI members, we will be sending this by mail. So you will have more clarity into the clinical and the legal aspect of the MTP Act. So thank you so much. We have to know MTP Act. It is not all that simple. So it is always better to do something correctly than not at all. It is better to be safe than sorry. Thank you so much for your patient hearing.